Covid-19 is the biggest event the GBC Newsroom has ever covered. We feel a huge sense of responsibility to get the tone right, the messaging right, and also to show people the reality of what's going on in our hospital. In spring last year, we spoke to intensivists, doctors, nurses, midwives, cancer specialists, paramedics, and others about how they were preparing for a surge in Covid cases. Our health professionals were keen to speak to GBC and share their experiences of the pandemic so far, the planning they were doing and the precautions they were taking. Their professionalism shone through in our reports. They helped us to show the public the GHA's preparedness for Covid-19. In early January this year, as cases soared and a second lockdown was announced, the GBC Newsroom knew it was time to get back to the reality of what the virus can do, to show people what health professionals were having to cope with. In the first week of January, we spoke to the medical director and the director of public health. Both suggested the medical professionals making up the GHA's Gold Command were in favour of GBC being allowed access to document the medical reality of the pandemic. It was suggested we should film inside the critical care unit, Rainbow Ward, Covid wards, the 111 call centre and accident and emergency. We formally requested permission to film inside the hospital on the 7th of January. We added ERS to our request later. The press office told us that the health minister had said no. In the following weeks and throughout February and March, we tried very hard to persuade the government to allow us in. We were told verbally that there were good reasons not to allow us in: infection control and patient privacy. In many countries, this combination of health worries and privacy concerns have made it difficult for journalists to go into hospitals and capture a portrait of this part of the pandemic. But in many cases, the news crews and the hospitals and authorities have been able to overcome these concerns. You've probably seen powerful coverage in the UK and Spanish media. The only footage of busy Covid wards our viewers have seen on GBC is footage taken in the UK, Spanish and Italian hospitals, as we were not allowed to film inside Gibraltar's.
I couldn't get upstairs without clapping and panting.
Always wore a mask, number of contacts with people kept to a minimum. So I always took it seriously. Taking it even more seriously now, you know. I want to see how vicious it is, it's nasty.
A picture tells 1,000 words. We felt GBC viewers deserved to see sensitively filmed footage of our wards here at St Bernard's Hospital. In the same way as GBC viewers expressed gratitude for our reports from inside the hospital last spring, others have questioned why our cameras did not show them the inside of the hospital or ERS during the deadly wave that claimed so many lives. The reality is, it is against the law to film inside the hospital without permission. We tried hard in January, February and March to get that permission, but it was not granted. We did film interviews inside the hospital in that time, but only where the vaccination programme was being delivered and on the top floor where the Minister and the Medical Director have their offices. As to filming inside the wards and speaking to health professionals there, we appealed to the Chief Minister directly. He said he understood why we needed to see and report on the front line of the pandemic. His press office tried to facilitate access through the office of the Health Minister. Unfortunately, it got stuck there. There's a bit of a twist in this tale. GBC now knows that 2 weeks after our initial request, the Health Ministry made a proposal to senior GHA staff for a private company to be brought into the Covid intensive care unit and Covid wards, so that vetted images could be issued to the media without the media themselves being given access. We know that a conversation was had among health professionals about how to mitigate the risks and how PPE and time in each ward would be best managed. We've seen this in writing, black upon white. The Health Ministry was prepared to invite a private company into the CCU and Covid wards while denying access to the public broadcaster GBC. The International Press Institute has urged governments worldwide to recognise the crucial role of independent news media in the coronavirus pandemic, and to ensure that emergency measures to tackle the disease are not used as a pretext to censor news or interfere with media freedom. Covid-19 poses a major threat to global public health, and the free flow of independent news is more essential than ever, both in informing the public on vital measures to contain the virus, as well as in maintaining an open dialogue and debate on the adequacy of those measures. In summary, we wanted to show you, sensitively, what the deadliest weeks in Gibraltar's recent history looked like, how doctors and nurses were coping with the pressure, and the no doubt excellent care our hospitalised COVID-positive patients received. We wanted you to know GBC was unable to do this as permission was not granted. Media independence is a core principle underlying democracy. Covid-19 is a public health crisis, but it should not be used as a pretext for restricting the public's access to independent information.